Occupational therapy is a diverse branch of the medical field that improves the function and satisfaction of clients in everyday life. One of the many areas that OTs are beneficial is the workplace. This is accomplished through collaboration between the therapist, employee, and the employer. The role of an OT includes evaluating the workplace and making adaptations when necessary. These adaptations are usually done to promote health and prevent injury in the workplace. Other times it is done to facilitate an employee's return to work after an injury or illness has already occurred. Overall, the role of an OT in the workplace is to promote participation, health, and satisfaction.
Adults with and without disabilities are part of the working class that drives this nation. Ergonomics plays a key role with keeping this population safe by using preventative measures as well as reactive measures when an injury occurs. Adolescent transition centers can utilize the principles of ergonomics and services of OT by preparing these adolescents to be successful and efficient for their future in the workforce. Employers and employees both benefit from ergonomic services provided by an OT. Employees who are healthier, happier, and satisfied with their work environment are going to produce a higher quality of work. This will in turn cut down on the out-of-pocket costs for the company, such as workmen's compensation, while meeting productivity standards overall and pleasing the employer. Injured workers are going to benefit from rehab services provided by OTs. This allows the worker to return back to work in an effective and safe manner. OTs have the skills to provide additional modifications that assist this individual in their specific trade.
Practice areas. Work rehab. Types. Acute injury and illness management determines any age gaps between the demands of the job and the individual's existing performance abilities and remediates or compensates for the differences in a timely manner. Work conditioning restores the performance skills of workers recovering from long-term injury or illness. Work hardening is multidisciplinary. It involves psychomedical, counseling, ergonomic evaluation, job coaching, and/or transitional work services. Functional capacity evaluation evaluates an individual's capacity to perform work activities related to his or her participation in employment. Environmental modification. The OT, worker, and employer make recommendations for modifications for the workplace. Transitional work programs uses the actual work tasks and environments as a form of rehabilitation. Ergonomics. OTs can assist with ergonomics because we have the skills and knowledge in anatomy, physiology, and activity analysis. We can facilitate the successful return to optimal function through the use of education, intervention, and adaptation. OTs can conduct assessments, develop interventions, provide health promotion and injury prevention education, design and modify workplace tools, and consult with employers and insurance companies on developing programs to reduce workers' compensation costs. Transition services for adults with disabilities entering the workforce includes physical, refers to physical demands of the job. Cognitive includes areas such as memory, ability to learn, problem-solving capabilities, and intuitive thought processes. Social, behavioral, emotional is the accepted social processes and interactions required to perform the job duties, and contextual is the varied environments and situations in which the tasks occur.
The work in industry focuses on the unique role of occupational therapy in assisting people to engage and re-engage in work across the lifespan. Through the occupation of work, one's health would be taken into account. According to the framework, a state of complete physical, mental, and social well-being is necessary in the workplace. Work in industry also needs to take into consideration context and environment. OTs look at the natural and built surrounding of the physical environment, making sure that people have optimal opportunities to work to engage in social interactions is the key to work in industry. Employers need to be aware of temporal context such as duration or rhythm of activity and how it is impacting their employees' mental and physical health. It is important to understand one's cultural customs and beliefs to ensure a holistic approach is provided in the work environment.
American Occupational Therapy Association is certain the demand for OT will increase through 2025. Vision 2025 is guided by the following areas. OTs are effective in using evidence-based practice when working with clients in their job environments on ergonomics, work rehabilitation, and transition services. As leaders in this field, we influence the changing of policies, impact on environments, and overcoming complex systems. OTs are collaborative with clients in the workplace to help them achieve their desired outcome without injury. OTs are accessible and are able to provide services in the different settings pertaining to work in industry.